Women's foot problems become a little bit more difficult to treat because of the need for fashion shoes, whether it's walking in the street on a daily basis, whether it's their job that requires it, or even just going to a wedding or some other occasion. What this high heel shoe does is it takes the woman's foot, puts it in a very bad position. It squeezes all the toes, so if they have hammer toes, it causes them to have blisters, irritations, corns and calluses. If they have bunions, it causes them to have irritations there. And sometimes even a small bunion, which is normally not painful, can become quite painful in a fashion shoe. Some of the other problems that women develop is ankle pain if the shoe is not fitting properly, as well as arch pain, and even most importantly, pain underneath the ball of the foot. And that comes because the woman's foot is squeezed into a high heel shoe. And if you look at the high heel shoe, you could see all of the woman's weight is really on the ball of the foot. So even if the woman is not very heavy, if she's a thin person, all of the weight going on the ball creates a lot of problems. They could develop pinched nerves, which is called an aroma. As I said before, the hammer toes, which normally don't hurt, could start to squeeze and pinch. They could also have bunion problems. But one of the most difficult problems to develop is metatarsalgia or bursitis underneath the metatarsals. It's usually underneath the second, third, and possibly even fourth metatarsal. The bones are getting very irritated in that area. They develop swelling and pain, and they really can't stand or walk, and they're very uncomfortable. So what can we do for this particular situation? Well, obviously we could use some oral anti-inflammatories. That's sort of like a Band-Aid. Yes, it can make the person feel a whole lot better. And if that's enough, that's perfectly fine if they sort of just do that for that one day. However, if this is a chronic problem, they need to really see what we could do to get pressure away from the area. Traditionally, what we do is we make orthotics or inserts that actually support the foot, get pressure away from the painful area, and distribute the weight so that we could walk quite comfortably. And that works in most instances. However, there's a small group of people where that just is not possible, it's not working, and they're really quite in pain. I'm happy to be one of the first people in Brooklyn to introduce the Clouds for Your Feet treatment, and what that is a non-surgical treatment to actually make you feel better. And what that is the use of an injection of medical grade FDA approved filler. It's very similar to the type of fillers that people use in cosmetic surgery where they have wounds or if they have a need to have their face look a little bit different. The dermatologists or plastic surgeons have been injecting them. No, this is not Botox. This is actually something to fill in the area so the area looks fuller. It acts as a cushioning area underneath the bone so that when you're walking on that area, you're actually walking on a pillow or a cloud. This is something that stays there for a long period of time, and so that the shoes that have always been killing you because of the high heels are very comfortable.